great question for a medical doctor who specializes in fertility. So let me go ahead and tag two of them here, and maybe they have some information on it.
Hello, Dr. Lucky Seacon, a double board certified OBGYN and REI, here to answer your burning question. Does everyone need to get their egg quantity checked when they reach a certain age? This is a great question. And I think that anyone who thinks they could end up in a position where they're trying to conceive their children in their mid to late 30s, especially if starting in their mid 30s and they know they want to have more than one child, this means realistically you may find yourself in your late 30s or even early 40s trying to conceive baby number 2 or 3, depending on your goals. Over the age of 38, the odds start to flip in favor of ovulating unhealthy eggs cycle after cycle. It can take longer to get pregnant, and you can have a higher risk of miscarriage. Overall, there's just an increased chance that you're going to need some help or intervention to help you conceive and build your family. So, yes, I would say these patients can benefit from a checkup, so to speak, where we evaluate their ovarian reserve. But more importantly than that, we're counseling them on what we think is happening, where we think they stand when it comes to their egg quality. And we treat each patient as an individual. We come up with a tailored strategy or a plan for them that makes sense with respect to their goals. This does not mean that everyone is told they need to freeze eggs or embryos, but we want them to know where we think they stand. And if they have low reserve at a younger age and have any risk factors, whether it be age or something else where they're at a heightened risk of needing treatment later down the line to build their family, it may make sense to preemptively freeze whatever eggs we have access to today to make IVF easier and more successful down the line. Similarly, if someone has red flags, things like painful periods, heavy periods, or irregular periods, I think it's never too early. There's no minimum age to go and see a doctor and have a conversation, especially to get an ultrasound to identify any really obvious issues like PCOS, endometriosis, fibroids. Not only can these impact your future fertility, but it can be a quality of life issue and important to know about your general health. If you have a family history of things like early menopause, that can have a genetic basis. And it's a reason to get your egg quantity screened early and have a conversation about what might happen in the future. If you have a normal egg count now, that doesn't exclude the possibility of still going into menopause early later down the line. So what can you do to work around early menopause in advance if you are in fact potentially at risk? So yes, there's a time and a place to go see a fertility doctor and get some baseline testing and investigation done, including things like an AMH test or a follicle count. But it's more complex than just testing those things. It's discussing your timeline, your goals, your GYN and your medical history, as well as your family history, and really gaining an understanding of how these different components are relevant and how they might influence your decision-making and your overall reproductive strategy.